Hey everybody, it's Jan here at Slow Money Farm. Overlooking some of the baby bunnies here. This group is the disadvantaged ones that had gotten their ears chewed up. They're pretty small still for what they are. It was a bigger litter with the other ones here that are just a couple days difference in age. They're quite a bit bigger for their size, or for their age. Sometimes that can be attributed to various things. Nutrition is one, the size of the litter is another. Obviously these two can get to the milk faucets easier than what the bigger group can, with competition and everything. However, that can also be an indication, particularly at stressful times such as weaning, which they were recently weaned, to need treated. We don't use a lot of medications here, but I wanted to take a minute here and show one that we do use. Come down here in the open. And this here is coccidia. We use this to treat what they call coccidia. This is a parasite that is basically everywhere. We don't use a lot of it. We use it in the water, and as you can see here, sorry for the jumps here, we use a 5-gallon bucket that goes to this, all but 2 of these. So to treat that, we're going to use the coccidia in the water. It's a 3 or 5 day treatment. We're going to go with a 3-day, and we don't treat necessarily everybody, but we do treat them when we see something that is suspect. This is how much they get, a tablespoon. They'll get this maybe once a year, if that often. So a lot of people will talk about how heavily drugged animals are and everything else. They're really not. A tablespoon. That's it. We don't use a whole lot. Some people say to use none. We do use none if we can get away with that. But if something needs treated, we want to treat it. For the health and the safety of our animals, coccidia is something that will kill them. We've had several birds that we lost to coccidia this year because we couldn't get the medicine in time. So it is something that's critical. It is something that needs treated. It's easily treated, relatively inexpensive to treat if you can get the medicine. So just another view here on using the medications.